This afternoon, the Finance Committee is holding its first meeting since March, focusing on the FDA's failure to adequately inspect foreign drug manufacturers for safety. In my view, the head of the FDA ought to be at this hearing to face tough questions on this issue. But FDA Commissioner Hahn is not with us today for one reason, and that is because the Trump administration blocked his testimony. The Trump administration did this to prevent the committee from holding the point person for the FDA accountable. I also asked for the committee to invite the journalist Catherine Eban to testify because she has literally written the book on this issue. That also, unfortunately, is not happening. In lieu of that, I would ask unanimous consent to enter into the record testimony and articles from Ms. Eban on this subject.
I'm sorry, without objection, so ordered.
Thank you, Mr. Chairman. While the committee meets for this hearing, COVID-19 is ripping through nursing homes and killing thousands of Americans each week. Unemployment is at near depression levels. The kindling laid down over the centuries of racial injustice was reignited by the murder of George Floyd. The president is agitating for more violence and more escalation as our nation suffers. The injustice driving peaceful protesters to the streets over the last few days is woven throughout society. Since the committee is dealing with healthcare in this hearing, I'm going to start my remarks with an immediate piece of urgently needed healthcare reform. COVID-19 has hit the African American community harder than virtually any other group of Americans. I would note in a recent analysis that was described in the Washington Post, it showed that counties that are majority Black have 3 times the rate of infections and almost 6 times the rate of deaths as counties where white residents are in the majority. The racial injustice status quo is simply immoral. There's a long and terrible history of our healthcare system working against Black people in America. From simply not listening when symptoms are reported, up to performing cruel experiments on Black human beings. That's part of why COVID-19 is having such an outsized impact on the African American community. There's a risk, for example, that when a COVID-19 vaccine becomes available, vaccination rates in the African American community may be lower because many in the community, for understandable reasons, do not believe that American healthcare is really looking out for them, is really going to give them a fair shake. So I want to make something very clear right now. This committee has real muscle when it comes to federal healthcare spending and doing something about what I just described. $2 trillion in spending in jurisdiction over flagship programs like Medicare and Medicaid, the Affordable Care Act, and more are inside the jurisdiction of the Finance Committee. So today, in beginning, I'm calling on this committee to come together and use all of that power and authority to right the wrongs of the past that I've described this afternoon. On our watch, this, colleagues, just has to get done. Now, as for the subject of today's hearing, I want to focus on one specific example, the FDA and the president teaming up to put Americans in danger. And I want to talk about hydroxychloroquine. Back in March, with the pandemic exploding nationwide, far-right media began talking about using this old malaria drug to treat COVID-19. The president seized on the reports without any valid evidence. He spent weeks declaring it to be the ultimate game changer in the fight against this horrible pandemic. The FDA, in my view, bowed to pressure and issued what's called an emergency use authorization for the drug. Doing so throws open the doors to tens of millions of pills, including some directly related to this hearing, manufactured inside facilities in Pakistan and India that have either failed FDA inspection or never been inspected by the FDA at all. Studies have now shown that the drug has no benefit for COVID patients. In fact, it is actually linked to higher rates of COVID-19 mortality. On April 24th, the Food and Drug Administration warned against using the drug in COVID treatments, and they said there were serious, and I quote here, serious and potentially life-threatening heart rhythm problems, unquote. The FDA says it still can be imported from unapproved manufacturing facilities. A recent article in the New England Journal of Medicine said the episode posed, and I quote, fundamental threats to the U.S. drug evaluation process. Mr. Chairman, without objection, I'd like to have that article from the New England Journal of Medicine put into the record at this point.
Without objection, so ordered.
The fact is, lots of Americans take this medication to treat other diseases, including lupus and rheumatoid arthritis. It's prescribed by their doctors, part of a valid treatment. They're counting on having a safe supply of their medication. And it seems Donald Trump has pretty much taken that away from them. He repeated a bunch of far-right pundits touting junk science. Now the U.S. market is polluted with tens of millions of hydroxychloroquine doses that may or may not be safe. It's not clear that there's a system in place to distinguish them from other stockpiles that came from unapproved sources. So if you're talking about FDA failures leading to greater risks for Americans, hydroxychloroquine is the case in point. There's also the botched rollout of COVID-19 antibody tests. There's the emergency use authorization for faulty K95 masks that pose a danger to healthcare workers and first responders. There's the fact that the number of FDA inspections of foreign drug manufacturing facilities were already down under the Trump administration. On this committee, we know that there's bipartisan interest in seeing improvements at the FDA. It makes sense for us to build our drug manufacturing capacity in America. However, the Trump administration just handed a big contract for COVID-19 drug manufacturing to a company with no experience manufacturing drugs and no facilities in which to manufacture them. That's not good enough, in my view, Mr. Chairman and colleagues. It's not a good enough plan to help COVID patients who are suffering right now. It also raises questions about how this administration would handle a COVID-19 vaccine if and when a vaccine becomes available. There is much to account for on this issue. The Trump administration's continuing effort to stonewall our oversight by blocking Commissioner Hahn from answering our questions today is preventing real, actual accountability. Still, I want to make it clear to our witnesses who are here or with us, we thank them for doing so, and I look forward to their testimony. Thank you, Mr. Chairman.